As nurses, we're encountering new technology every day. Some of it good, some not so good. And we have to evaluate these new tools critically because we are responsible for the lives of our patients. They have to work. They have to let us take care of our patients easily without getting in the way. And we have to know that they are making healthcare better and safer for our patients. When it comes to specimen collection, nurses are challenged with getting the right specimen at the right time, on the right patient, so that the right test can be performed and the right diagnosis can be made by the physician so right treatment can be initiated right away. Add to this the other guidelines such as national patient safety goals, internal quality metrics, and hospital and compliance standards, and it's clear that specimen collection is much bigger than getting the right blood in the right tube. A lot depends on us, and we can depend on Sunquest Collection Manager. Sunquest Collection Manager is a very simple process that allows you to positively identify the patient and print the labels in the presence of the patient. When it's used the way it was designed, and nursing input has been critical for ongoing improvements, there are no errors, ever. Let's talk about how this works. Sunquest understands how precious healthcare dollars are, so Sunquest Collection Manager can use a technology you are familiar with and already have in place. To use Sunquest Collection Manager, you need three things: a computer or Citrix unit at the bedside or on a workstation on wheels, and a barcode scanner or a handheld device, the Sunquest Collection Manager software, and a label printer. Your hospital laboratory will arrange for all of this with your nursing leadership. Now let's begin. Sunquest Collection Manager can be used either on the workstation on wheels, a computer mounted in the patient's room, or on a handheld device. To draw labs while using Collection Manager, assemble your supplies and go to the patient's room. Log on to Sunquest Collection Manager. Perform positive patient ID for specimen collection. You do this by simply scanning the patient's armband and obtaining verbal or other verification of the patient's positive identification using two identifiers, such as the patient's name and date of birth. Confirm the tubes or containers needed. You will see the tubes you need on the screen in Collection Manager, and you will see the order in which the blood specimens need to be drawn. Another exciting feature of Sunquest Collection Manager is that if another lab order happens to be created on your way from the nurse's station to the patient's room, it will show up when you scan the patient's armband. This way, the patient won't be stuck twice, which is difficult and a risk for any patient, but even more so on the critically ill pediatric or oncology patient. Then draw or obtain your specimens. Print labels and apply to specimen containers at the bedside in the presence of the patient. In this way, you're performing an extremely important process that ensures the patient's safety and fulfills National Patient Safety Goal 01.01.01. If you need to make a comment on the test you've just drawn, you can do that now. Sunquest Collection Manager includes this in the laboratory information system, and the lab gets the information immediately. Record your collection within Collection Manager. Exit Collection Manager. After you've drawn or collected the specimens, send your specimens to the lab in the way you usually do, according to your hospital's protocol. If you're using a handheld device, return it to the docking station to recharge. And you're done. Sunquest Collection Manager was developed to contribute to patient safety through two critical features: positive patient ID and prevention of specimen mislabeling. How does it do this? Let's talk first about positive patient identification. When you and your nursing team use Sunquest Collection Manager, you and your patients get immediate results. The potential for human error is reduced at every step in the process. We know that nurses and hospitals are always doing more with less, and we all know that patients are sicker and sicker, requiring even more care. No one ever intends it, but the chance of making an error in labeling or identifying the patient is very real. Wouldn't it be such a relief to know that your patients and you are protected from mislabeling errors every step of the way? Improved accuracy. Patients are correctly identified the first time. There's no need to worry for them or for you. Positively identifying your patients results in what we all want as nurses and as patients: patient safety. These patient safety benefits help you eliminate labeling errors, reduce your potential liability, fulfill Joint Commission National Patient Safety Goals, limits the possibility of incorrect patient identification by scanning barcoded patient armbands. This allows for positive patient identification. It limits specimen labeling errors, as labels are printed right at the bedside. This eliminates the need to sort through a pile of labels sitting in a central location. Who knows what could happen? Improved result turnaround time to support clinical decision-making. Again, no sorting through a pile of labels or trying to force print labels. Think about that at AM lab draws. Specimens are collected only when needed, so no extra labels are lying around, and there are fewer redraws because of labeling errors. There's less wait time for patients needing draws or lab tests. You have less stressed patients and more satisfied healthcare team members. Patients get the right diagnosis and treatment at the right time. Diagnosis and treatment are never delayed because of mislabeling issues. Sunquest Collection Manager helps you manage your patient's specimens right the first time, with an easy process that helps you do what you need to do. Take good care of your patients. Your day is filled with much more than lab collection. Sunquest Collection Manager can help you get your patient labs quickly and easily, so you can get back to the care that only you can give and that your patients depend on. When so much depends on you, you can depend on Sunquest Collection Manager, because Sunquest is as committed to patient safety as you are.